Hi, everyone. Thank you for your patience. We were having a little bit of technical difficulties this afternoon, but we're going to give it just a few minutes. We'll start at 1:04, give some people some time, rather, to come on in and get settled, and then we'll get started. Thanks, y'all. All right, we're going to go ahead and get started. Hi, everyone. Usually this is where we come on camera. Like I mentioned, we're kind of having technical difficulties here at WREN, so I will not be on camera today. But my name is Katie DiTilio. I'm the Senior Legislative Affairs Associate here at WREN, and I'm joined by the brilliant, wonderful Aisha Jones.
Oh, Katie, you are too kind.
And our lovely Senior Partnership and Engagement Associate. And we are so excited to talk about our Status of Women and Girls report, and we call this From Data to Action. So the breakdown for this one, we're going to focus on the reports themselves, what we learned from them, and then what we're going to do with them. This is a part one to a two-part series. So in December, we're going to talk about the community aspect of this project. So we're really excited to talk about it.
Yes.
So you ready to go, Aisha?
I am
get rolling?
Ready to get rolling, Katie.
All right. Let's see if it'll let me. Just some housekeeping. The webinar is being recorded. Chat can only be used by us and our co-host, the beautiful Brianna Myers. That is our Zoom bouncer. So you'll be able to use the question, there's like a Q&A button down there at the bottom. You can submit your questions there, and then we'll go over them at the end. And live captions are also available. It's in that same spot with the question bar. You'll click the icon to enable them. All right. Aisha, tell us about yourself, girl. Who are you?
Oh, hi, everyone. Thank you all for being here today. So just a little bit about myself. As Katie mentioned earlier, I am Senior Partnership and Engagement Associate for WREN. I often have to remember my title because it is a ton of words. But as you can see on the screen, I am not going to rattle off my whole bio, but I am a South Carolina native, born and raised here, more specifically West Columbia. And for those of you that are wondering, yes, there is a difference between Columbia and West Columbia. But I am very involved in community. So this role is basically like passion and purpose together, right? So I'm able to get out to talk to the people. And so this webinar is just going to help me continue to do what I love doing. But my background, I'm involved in several different community organizations. I am a proud two-time alum of the Columbia College here in Columbia. But yeah, I am super excited to be here with all of you today. And some of you I may have met out in community, and if I have not met you yet, I hope we get the chance to meet each other soon. So I'm gonna give it right back to my girl Katie. Let us tell us a little bit about your brilliant self, Katie.
Well, thanks, Aisha. I'm so glad you're here. I'm glad you're on the team, and I'm glad you're here.
Thank you.
This is me. a couple hair colors ago. I am our Senior Legislative Affairs Associate, so I'm our research arm. I'm the host of the webinar series. I get our beautiful guests on, and we talk about our issues. I track our policy, I analyze our policy, and research is a big part of my job. So that's why I'm really excited to share this report with you and get to talk to you guys about it. Because I think what we found, while kind of hard to see, is very interesting and cool, in a kind of weird way, I guess. So I'm really excited to talk about this. This is our objectives today. I always do a who we are piece, because some people may have seen this in passing and they were kind of interested. So I want to make sure they know who WREN is and the work that we do. I'm going to tell you what is this report, what's the whole deal with it, right? The key findings, going through each of the sections and highlighting some staggering data, I think. And then we're going to connect that data to what we want to do next, which is number 5. So let's get moving. Let's get rolling. Who is WREN?
Who are we?
Who is WREN? Really want to talk about our mission?
So our mission here, we advocate, educate, research, and convene. So we are in service to women and girls in the state of South Carolina. Now we say women and girls, we are in service to women and girls across the state of South Carolina. However, I'm going to add to that. When we know that when we advocate for women, we are advocating for our entire community. So again, mentioning my role in particular, the advocacy, the convening part, the educating part, that's a big part of what I do. But our mission as a whole are these 4 areas that you see right here. So we engage with community, with those of you all throughout the state of South Carolina in order to promote the policy efforts that we are trying to make here on a statewide level. We prioritize education because we know when we educate our community, we become empowered. And when you are empowered and informed, you are better equipped to engage. That is a big reason why we're on this webinar, y'all. This huge.
But this research is really what helps us shape the work that we get to do for South Carolinians, because I think we can all agree, and we're probably going to say this more than once, South Carolina deserves better, right?
Doing our part and doing that work to make sure that we are building and growing to a more equitable South Carolina and convening. Here I am again. I love to be in community and bring community together. So this is actually a convening. It's virtual, but we are convening because here we are all community, right? So we bring together our stakeholders, other partner organizations. We believe in collaboration. While WREN does the work that we are able to do and we do it well, we don't do it alone. And we recognize there is power and there is strength in numbers. So this convening is not simply just about us convening community members. There's other organizations who are also aligned with our mission and our focus areas in order for us to be able to get this work done together. So that is a little bit about who we are.
Absolutely. And you can see this report is a beautiful mix of all 4 of these pillars.
Yes.
So just as a note here, our legislative priorities have 2 pillars, and under those 2 pillars, we have 3 smaller pillars where bills fall under. So we focus on economic justice and reproductive freedom. Economic justice just means everybody should have a fair chance to earn money, have a job, and live a good life. And this year, our policies are focusing on childcare, paid family leave, and workplace non-discrimination. Then next pillar, reproductive freedom. It is ensuring that people have access to the full range of healthcare services that they need. We're talking pre, during, postpartum, anything they need throughout the entirety of their life, not just pregnancy. I'm just not thinking of any other words right now. Contraception, fertility treatment.
Yes.
So our 3 pieces here are access to abortion, so protecting access to abortion, which I want to shout out everyone that we had really big win with Senate Bill 323 this week. That would not have happened without all of our wonderful partners and all of you going out, making noise. They listened, and that bill is she's dead for now. There's a couple ways that they could revive it. Abortion is always on the table, but today we celebrate. And then protecting access to IVF, and then improving access to doula and lactation services. So I put these in here just because this kind of informed the type of research we did, right? We want to focus on these areas. So what does it look like in South Carolina now? That doesn't mean we stayed fully in these lanes, but that's how it started. All right, and so what is this report? What is it? We need to know. Who's affected? Why did we do this? I'm so excited to talk about it. So the reason is simple, right? We wanted to get a lay of the land so we could see how people are living now in each county. I'm sure people can imagine, but finding county level data in this state is very hard. So it was important to us to make sure that we could compile as much county specific data on the status of women and girls in our state, so a community can see its own story. So we wanted to raise awareness about these issues. We wanted to guide advocacy on these issues. We wanted to shape how we invest and where we spend our time. And we were just to our mission, we want to build a future where every woman and girl can thrive. And Aisha we're gonna talk a little bit later about the county specific events that we're gonna be hosting. But Aisha, what were you most excited about when we were starting this report? What were you wanting to learn?
I think I was most excited about all the data that went into this report, but selfishly, I was excited about figuring out how we were going to be able to share this with community, right? And so more about maternal health in our state, because unfortunately we are at the top of the list for maternal mortality rates in the country. And so I wanted to be able to get more into that deep dive, because as I'm going out in the community and participating in community baby showers and being work, that was really important for me that we could carry this out into state and into the state and the community to show people not just what's happening statewide, but what's going on right in your neighborhood, right in your community, and how you could get involved. I was dive into childcare because childcare is a big deal. South Carolina is in a childcare crisis, and being part of many villages where children are, and having friends and family and all of those and having children in my family, I know that is something that's very, very important to us. And so I really was interested to learn more, but I also wanted to hear from community. What does the childcare landscape look like where you're from, and how does this feel to you? What is it that you'd like to see? What are your hopes for these areas, maternal health and child care, and also the work that we did on food insecurity, housing sustainability, basically all the things, Katie. I love that. So I wanted to see what was happening here, but it was very important for me to see community, have us bring this to them and let them know, hey, we're doing this work. We're never stopping.
And a big part of this, that's a very good point. A big part of this, right, is we find this data and then we lay it all out, and then we're going to go out and be like, hey, is this true? Is this how do you see your community? We've already gotten feedback at one of our events. They're like, hey, this says this has how many OBGYNs? Because I don't know where those are.
Where are they?
And so that feedback is really important. Where are they, and why don't people know about them, right? So very excited about this report. It's very multi-purpose. So we have some focus areas that we got into. So like you said, maternal and infant health. So the health, safety of well-being of women during pregnancy, childbirth, postpartum, and then the health outcomes of those infants, right? Within the first year of their life. Then we also talk about access to care, which I touched on here a minute ago. We want to make sure that how many maternity care deserts do we have? How many OBGYNs does this area have? Do we have lactation consultants? Do we have doulas? How far away are the hospitals? And so focusing on that access to care portion was a big part of this. Also, we focused on economic well-being and wage equity.
Mm-hmm.
That is, I put that all together, but that is such a massive category.
It is.
I mean, housing falls under here, food insecurity, wage equity, obviously it's in the title, but, you know, and we're, you know, with the data, you're going to start to notice a pattern that our state is not very kind to women of color.
Right. And along the lines of like wage equity, Kay, like Anissa, we put it all together, but it's really, really, I think important to be able to see how we already know that equal pay is not a thing, right? And so we know that it looks even different depending on if you are a woman, if you are a person of color. So to be able to see the research put into that and broken out into the different demographics, I thought was very, very helpful, right? And that gave people an insight onto exactly what's happening here in your county and in your community. So,
you know, women is not one size fits all.
Right.
And I think that's a misconception. It was something I even learned in school that women don't, they are thought to think like vote in a block, and they very much don't.
Absolutely.
And then of course, Aisha mentioned it, childcare. Everything that goes with it. Affordability, availability, and the quality of it, right? So, you know, can they get to the daycare, and can they afford it when they get there, and can they afford the diapers?
That's right. That's a big part of it.
If you missed our webinar with Ayana, it is on our YouTube channel. It was very very fun conversation about what she's doing in the community and how you can help. So if I
her organization is Power in Changing, and it is a community diaper bank. But they do more. They provide more than just diapers. There's formula. There's children's clothing for newborns, infants. So please.
To focus our research, which is kind of funny now that I'm saying it, that they were focuses, because this is just kind of like being alive. But it's hard. Like these are like what'd you focus on? Oh, everything. So let's move into some of what we learned, right? So these are the over umbrellas. Big challenges.
Big ones.
But with big challenges comes big opportunities. There's so many things that we can get our hands in there and fix. Hopefully, with your help. So that we saw like a lot of things that needed to fix, but that means that we can start brainstorming with community on what that would look like. Economic stability is out of reach for many. Maternal and infant health needs our attention. Childcare is in crisis. Housing is scarce. And access to essentials varies by zip code.
Which is interesting.
Was this par for the expectation for you, where you're like, we could definitely be doing better? You think, Aisha?
I think all of what we learned is kind of what I expected that we would learn, but I really want to point the first part of this really speaks to me as someone who's being in community, very community minded, is that while we often face big challenges, we have big opportunities. And if anything has been demonstrated just this week along with Senate Bill 323 failing, that right there was one of having the advocacy and the voices of the community. That bill was a challenge and all that came along with it, but it was also a big opportunity for everyone to come together. And that's what happened in seeing this bill fail. And so this report is a highlight of that as well, right? And so I always want to make sure that I point that out to say that sometimes things look a little grim. You may look at this report when we bring it to your county and say, wow, I had no idea. This doesn't look good. Yes, but there's an opportunity. That's how we start to build out this advocacy, right? So I do feel like all the work that we put into this, we went into this with the mindset of this is helping us do the work that we do for a community, but none of this work as we move forward is going to be able to be done without community. And so we're all going to continue to learn and to grow together and to shape these policies, lasting and systemic change that we work tirelessly to do on behalf of women and girls and families in South Carolina. So I feel like these are some good takeaways. Looking at these are the kind of takeaways that I hope that we would see as a team and as we're moving out in the community as well.
Great. Yes. I appreciate that insight. And
shooting some sound right now. it's still fading in and out. I'm trying to figure out what the problem is. Let's try. Now, yeah, everybody knows technology is great until it isn't, right? So we are working through this. So we do apologize if the sound is going in and out, guys, and if everyone has been able to fully hear us. But we are definitely working through that. Again, we talked about challenges earlier. This is an opportunity for us to get this sound together so that we don't have this on future webinars. So again, we do apologize, but thank y'all for hanging in there with us and for being patient while we work through this. We're gonna pull it together so that we can move forward in this webinar. And I just want to say I look forward to those of you who live in areas that I have not yet been able to get to county-wise, forward to coming out and seeing you. So, but thank y'all again for hanging in there with us. We're gonna keep moving through this. We identify where these sound challenges.
So Brianna says, she said, yes, it's better now, kinda. So I'm gonna roll with that
Okay.
and hope that it improves.
Okay.
And I've moved the laptop closer to me, so maybe that will help something. I thought that it was coming from the webcam, but who's to say? So thank you guys for bearing with us. We're gonna move on to this key findings section. So we're gonna elaborate on what we have, those parts that we just talked about, put some numbers to it. Phew. What is going, guys? I think the rent office is
I'm
haunted.
telling you,
Um,
you know what? Technology is fighting, but we fight hard. Okay, we're getting this together, y'all.
So for many, like we said, economic stability is out of reach for many. 1 in 3 households in South Carolina cannot afford basic needs. That's childcare, housing, food. Women in South Carolina earn just 79 cents for every dollar. The national average is 81 cents to the dollar. So we are below that. And Aisha, do you think women of color are making 79 cents an hour?
And women of color are not making 79 cents an hour.
Try 53 to 54.
Yep. And I want to say what this shows us overall, what all this information shows us is that everything, all of our basic necessities, housing, food, childcare, those prices continue to rise, but what's not rising with them? Wages, right? So the things that we need, the cost of those things is outpacing the money that we are earning, and even less so if you are a woman, and in particular, if you are a woman of color. So a lot of these numbers are very, very jarring. Very.
And we knew that, like Aisha said, the wage gap is nothing new, but to see us doing under national numbers by a lot. I mean, the gap for Black and brown women is one of the largest in the country. So we have definitely some work to do there. And then 10.1% of families in South Carolina live below the poverty line, despite relatively low unemployment rather. It's great to have a job and you need a job, but if it's not taking care of you, then it doesn't matter if everybody has a job if it's not taking care of you.
There is a such thing as being underemployed.
Yeah. And so to kind of put a cherry on it, the median income in our state is 46,176. But this is very much it's a median. A lot of it looks very different. Women are overrepresented in low low wage positions.
Over low wage.
A food service, daycare workers are some of the most underpaid, and women are overrepresented in those categories.
Literally the definition of overworked and underpaid.
Right.
Overworked and underpaid.
So these numbers were really interesting to me, and it was. We worked with EPI a little bit, the Economic Policy Institute, to get some of these, and that was a really fun conversation. Again, I say fun, you guys know what I mean. Like, it's not like, whoopee, the 79 cents, but it's like, it's really interesting to see this research. Any thoughts, Aisha, before we move on?
No, I think I've stated my thoughts. This is hard to look at, honestly, y'all. And I know I'm not alone. It's very hard to look at. And just to know that the median income for women is where it is in this state. Um, yeah, it's hard to look at. And so again, this is what continues to drive us, to fuel us to try and do this work and come up with policies to improve these outcomes so that we're not looking at the same data, these statistics 5, 10 years from now. So yeah, it's a lot.
Yeah, it's definitely tough to look
Yeah,
at.
it is hard to look at.
We got a lot of work to do.
It is.
And maternal and infant health needs our attention. And that sentence is carrying a lot of weight. I think this is talk about understatement.
Understatement, sure.
So Black women are more than twice as likely to die from pregnancy-related causes than white women. Twice. That's double. That is that really bothered me.
It's scary.
It's very scary. And then this was very interesting. So these numbers are from the maternal morbidity, and it's a very long name. But Nadia Rutherford released it last year. It's a very wonderful report that summarizes all of this very well. So on that report, though, they said 100% of pregnancy-related deaths due to mental health or substance use were preventable. So that was like seeing 100% of anything.
Unbelievable.
Like so they're more than twice as likely to die. And then they can't get support on mental health or substance use. Being pregnant in this state is scary.
100% of pregnancy-related death due to mental health or substance use were preventable. Translation. None of these women had to die. Right? I had to sit with that for a second. Because that says 100%. Not 90%, not 63%. 100% of pregnancy-related deaths due to mental health or substance use were preventable.
That was I had to read it twice.
Yeah.
Because I was like 100%.
100%.
The infant mortality rate is 7.3 deaths per 1,000 births. But we're keeping that twice as likely moving for Black infant mortality, which is nearly double. And then we have about 11.6% of babies are born preterm, and then 10% have low birth weights. And I put that on there because this is both higher than national benchmarks. So, we are not supporting women throughout their pregnancies. Lactation support is not covered, doula support is not covered.
Right.
They are not being listened to.
Right.
And then you have the mental health and substance use are like you're not getting support because mental health support is expensive and sometimes not covered. And there's criminalization of pregnancy.
Absolutely.
So these numbers definitely built a bigger story. And so then once the baby's here, we have health concerns there.
Right. And even a big part of this too, you guys, it's access to care. It's those OBGYN deserts that we talked about that exist in many counties in this state that contributes to this maternal mortality rate that we're seeing in South Carolina. So yeah, again, we say this and not a lot, but it can't be said enough because it's true. We have a lot of work to do. A lot of work to do.
Absolutely. So we're gonna kind of shift. So the baby's here.
Right.
And now we have to talk about childcare. So nearly 50% of South Carolinians live in a childcare desert. And this state has only 1,426 licensed childcare centers, which would be one for every 247 kids.
Wow.
You were principal for a day yesterday.
I was.
One person or one center is enough for 246?
Absolutely not. Absolutely not, y'all. And we're laughing, but we do recognize it's not a laughing matter. But you all, if you have ever worked in a daycare center, a child care center, a school, elementary, middle, whatever, you recognize that this ratio is impossible. One center for every 247 children, that is nowhere near enough. Yeah. Nowhere near enough. And we've already mentioned that childcare workers are among the lowest paid workers in this state, right? We've also already talked about how people can't afford basic needs. So if you're among the lowest paid workers in the state and you've got to be able to afford basic needs, you're going to try to look for another job that's probably going to pay you a little more, which takes you out of childcare, which now makes that ratio even greater because we've lost it with childcare. So you all can see where we're getting at here. How this all overlaps and works together.
Yes.
In furthering this crisis that we have in childcare in South Carolina.
And I wouldn't be an employee of this organization if I did not plug Senate Bill 47.
Yes.
This is a bill by Tom Davis that would provide tax incentives for businesses to provide childcare for their employees, and then also provide tax incentives in the form of a tax credit refund to those that work in childcare. So we hope that we can get more centers and more people working in those centers. Another number, I've been repeating this one a lot because it just so, so annual infant care costs a little over $9,000, which consumes 28% of a typical family's income. The number here, it says it's 4 times the federal affordability standard. So let me talk a little bit about that. The federal affordability standard is 7%. So 28% is a lot higher than that. And the first thing I thought of when I saw that number is they tell you that rent should be 30%. And that is considered an absolute essential basic need. And you're supposed to be paying 30% for your house. And now you're paying 28% for child costs. And so now you're at 60%. So now 40 has to go to everything else. And let's be honest, people are not paying 30% for housing at this point. So for something to be 28% of your income that's a lot, and that's unaffordable. And so 15% of children live in households where a parent had to quit, cut hours, or turn down a job due to childcare challenges. And you guys are probably going to find that this is everything's really connected. Because you know what, if that parent can't work because they can't afford childcare, then they're not going to get more money that way.
You're not getting more money that way, and that's a loss of income.
And women are obviously disproportionately the ones that step away to care for children. So this whole picture, there's not enough childcare centers, and when you can get your child to a childcare center, it's incredibly expensive. So definitely a barrier here.
Incredibly expensive, sometimes not quality. There are a lot of different factors that come into play when we're talking about childcare. And for those on the call who are parents, when you have to make the tough decision about childcare, where to take your child or children, your child is the most precious thing to you. So you want to make sure that they are in this facility, they are in a center where they are going to get care that's just as good, if not almost better than what you yourself give them. So we have to make sure we're addressing this crisis by also factoring in quality and making sure that we have that it is accessible, because quality childcare doesn't just belong to a select few. Everybody should have access to quality childcare. So I just wanted to point that out.
Absolutely. Yeah, it's kind of like when you talk about classrooms.
Yeah, exactly.
Exactly. It's harder to teach a group of 35.
It is.
It's just 20. So this is definitely something that we are working on, and we hope that you'll talk to your legislator about Senate Bill 47. If I was talking about it and you're like, dang, that sounds really cool. We'd love to tell you more about it.
Absolutely.
And then access to essentials varies by zip code, which is something you kind of touched on, right? This should all be for everybody. The wealthiest of us should not get everything, and the poorest of us to dry. So about 13% of our residents experience food insecurity across the state. And we kind of touched on this earlier, but 27% of renter households are extremely low income, and 71% of those families are severely cost burdened by rent. And I didn't put this on here, but something, when Amalia and I were first like looking at data from the report, something that really stuck out to us, one statistic we saw that a minimum wage earner would have to work 90 hours a week to afford, a one bedroom. Which is obviously not possible. Well, it is possible, but you don't want it to be possible.
Right.
We work 40 hours.
Right.
And I think I'm at my limit.
Yeah.
So, I think about that number a lot. The minimum wage is its own, own demon.
It is.
But, definitely stuck out to me, and I think it was like 108 hours for a 2 bedroom. So very unattainable for those in minimum wage jobs, which we just discussed are disproportionately women. And then kind of talking about access to care in those like maternity care deserts, women in South Carolina must travel an average of almost a little over 9.5 miles or 15 minutes, which sounds pretty good until you think about rural counties where it's, I believe this, I don't want to misquote it, but it's over 30 minutes for most of our rural counties.
Right.
So this is definitely an average, but we have to remember like not everyone is driving 15 minutes over to Prisma.
Yeah.
So there's definitely a maternity care desert issue, and with not close enough hospitals for everyone. And also want to point out that in 2024, a little over 8,000 South Carolinian residents had to travel out of state for abortion care.
That is.
I'm sure you hear the siren. Okay. Sorry. Yes, sorry. An emergency in South Carolina. Hope everyone's good. But I wanted to put this in here because we had the hearing this week, and something that they brought up was like, oh well, the bill's working. The 6-week ban is working. Abortions are going down. They're not going down. They're going somewhere else. They are certainly down in the state because they can't have them.
Because they can't have them here. Right.
So this abortion access is still a very important part of healthcare access. And these people traveled out of state. The majority of them went to North Carolina, which during the hearing was frequently brought up to the point where Senator Hutto wanted to do hashtag travel to travel to North Carolina. And then just another note, kind of going back to food insecurity, many families fall into what's called an assistance gap. So they earn too much for SNAP, but still can't afford groceries.
That is a tough spot to be in.
You hear a lot like, getting FAFSA aid for college. It's like my parent makes too much money.
Right.
But now these, it's the same kind of thing. Where you just make maybe $1,000 over the threshold.
Right.
And you just can't afford your groceries. So a lot of work to be done still. And I'm thinking, and Aisha, I want to like zoom out a little bit because these are hard facts. And there's a lot of great stuff still going on in the communities.
Yeah.
And I don't want this to make it sound like, the place is on fire. Even though sometimes it feels like it is. So while we are highlighting some of the more tough facts, things that are driving things that we need to change, I want to make sure, like we mentioned earlier, power and changing. Aisha's on the ground of Revolution Red.
Yes, Revolution Red. I want to shout out the work that they are doing to address period poverty throughout South Carolina. We talked earlier about basic essentials and basic needs, and I think for a lot of us, we take it for granted, right? We can walk into a store and get what we need, get basics, especially as it pertains to feminine hygiene products or period products. But that is not the story for many. And so that is something that a lot of people don't realize is an issue, but it is. And so we're grateful for organizations like Revolution Red right here in South Carolina, based in Columbia, but doing work to address period poverty all throughout the state of South Carolina. So it can't be said enough that there are a lot of great things still happening in community because we kept saying it. We got work to do. We got work to do. We're doing the work, and it's good to know there are other organizations out here who are also doing that work with us. So that collaboration, and when we come together, we can be unstoppable, and we can get this work done. And we're talking about SNAP. I think a lot of people have seen just throughout the, watching the news alone, and you may be part of organizations who are addressing the issue, but when there was a delay in SNAP benefits being dispersed for recipients, how communities stepped up to make sure people get fed. Y'all, Thanksgiving is right around the corner. Big eating day, right? Big eating day. And so in addition to already not being able to buy your regular groceries, that's compiled with a major eating holiday. And so just watching community step up and come together, and we saw it even at the State House. There are things happening. We are still coming together. Great organizations are out here doing the work. We talked Old Spire earlier, making sure that our children get fed, and there's a lot of organizations.
Appleseed,
Appleseed, yes. Legal. Yes, because we talk about legal. I'm gonna pause there for a second, because civic engagement, guys, y'all know all the work that we're all doing that's around policy. Policy starts with who you put in office, right? So make sure that we're voting. And Legal Women Voters is an amazing resource for you to get additional information on how to vote, where to vote, and all those wonderful things.
I want to make sure I said Liz for some reason.
Lynn, yes, Lynn and Lynn.
I don't know. We have a lovely new staff member, Liz, and we were talking with her all morning, and
yes.
I guess I'm reading.
Yes.
So just bring that back. Like, the community is doing great work. That's why we want to bring this stuff to communities, so they can tell us what they're seeing while they do the work. And if it matches up to our numbers. So those were some of our key findings. I just kind of went through the report and found some cool, not cool again, but I found some interesting statistics for us to discuss. So we're going to take this data now, and we're going to talk about how we want to use it, and how we, we would love for you guys to use it. For creating action and informing your own advocacy. So this is how we're sharing the reports. So it's on our website. We're doing a webinar. Would you believe it? We're talking to communities. We're doing presentations. When it dropped, I was emailing partners. We were talking to the coalition. And I don't know if you guys saw on the news, but Tamika Isaac Devine commented. So it got to policymakers. So we're sharing the profiles with our local leaders. And I put this webinar again. I guess I was really excited. But there's a very specific thing we're gonna start doing. I do have a slide for those. But we're hitting the town. We are. And Katie mentioned that this report has gotten to lawmakers. I'm gonna say, if you have a relationship where you are engaged and have a relationship with your lawmakers at the state level, and you're not sure if they've seen this report and there's things in here that concern you, this link is available. Send it to them. And if you need to know how to find out who that lawmaker is, reach out. We will make sure you get that information. Get this to them, because, again, this is helping us shape our legislative priorities when we move into, the next legislative session, which will be what, we're in a 2-year session, so 2027. Yes. So the second year for this year is 2026, and then when we're starting anew, yes, that's 2027.
So get this to them. We would love for them to see it.
Tell Nigel earlier, I'm already in 2026.
Yes,
the year is over for me. So this is how we were hoping. This was the vision. Obviously, this is not an exhaustive list.
Right.
If you're like, man, I want to do this one specific thing, but Katie and I shouldn't mention it. Please do it. But this is kind of what we were thinking, right? So use the data to elevate community needs, State House, and then ground our policy recommendations and localized evidence-based findings. And hold on. Then so that moves also into like grant proposals and resource allocation. So fun fact, this project kind of started in the grant process, and it bloomed into something way more beautiful and magnificent than we could have ever conceived. And we're so excited about that. But like, if you're trying to get funding for a certain issue that needs help in this report, you can use this data and be like, look, I want to help with housing. 1 in 3 households in South Carolina can't do it. And then they'll be like, great, let me write you a check.
Yeah.
And then I can also direct resources to communities with the highest need, right? Go into those places that are probably often forgotten. And then we're going to talk more about this, but Aisha is going to be hosting conversations. We would love for you to do that. If you have a group, present them at schools, talk to faith communities, your workplace, if they're cool with that.
Yeah.
Civic groups, and then talk to your neighbor. That honestly, at the end of the day, the report is a conversation starter.
It is.
And an informant, and a little bit of a roadmap.
Absolutely.
So like I said, it has a lot of purposes and a lot of parts, and we're really excited about that.
Community is just as much a part of this research and this report as WREN is. This is our thing. This is our project together. Because Katie, you talked about it, like our vision and what we hope will happen as a result of this research coming out. But again, when we are talking about this at the legislative level and getting with our lawmakers and everything like that, if there is something that is important to you, we all know, guess what's coming up next year? Midterms. Good time for you to make sure as they're coming around and asking for your vote and coming to all of the things. Hey, were you aware that this is taking place in our county? What are your plans for this?
How are you going to fix it?
How are you going to fix this? How are you going to be a part of the solution? So again, we're all going to be working together with this. So
we're not hoping to throw this report out and then be like, all right,
that's it. Do with it what you will, guys.
Good luck. So this is what we've done so far. We had our statewide launch event on October 23rd. We released the report. That was the big drop day. We shared statewide data. And then the county level data, this was Richland and Lexington counties. And we had a lot of great conversations. So I wrote that we sparked momentum. I was like,
absolutely.
There were so many, you can see in this like top picture here, you see Amalia and Aisha, and Aisha's kind of serving. Aisha's serving, guys. But she, a lot of great conversations that night, and here's Amalia introducing the report. So that was a really fun night.
Yeah, lots of interesting conversations and feedback came as a result of that. And hey, that is exactly what we want. If there's something in this report and it doesn't quite make sense, or you're trying to figure it out, or you want to see a little more, or let us know. It's a conversation, right? It's a dialogue. That's two ways. So we don't want to just, like Katie said, throw this at y'all and be like, see you later, WREN's on to the next. No, that is not how we do things, and that is not how community-centered and community-informed policy work happens. So tell us when we're in your time, let us know. And if you go online and read this and we haven't come to your county or where you are yet, and you see things, all of our emails are available. Let us know.
Yeah.
So we can talk through this thing together. But yeah, we are definitely excited about this launch. It kind of reminds me of like when you're waiting for your favorite musician to drop an album. This was our drop.
Except WREN's my favorite musician.
Yes. This is our drop, and now we're on tour.
Yeah.
Putting our body of work out here. So be engaged with us, because this is what we want and this is what we look for. We need that.
And there is a space on the website if you want to provide anonymous feedback.
Right.
It is at the bottom of the page. Also, we had the Sumter event.
Yeah.
What day was that?
Last week, November 13th.
Okay, and here she is again serving.
Okay.
And here's a beautiful picture of the turnout. It looks like a great turnout.
Yeah, that was
talk
before it. That was an amazing turnout, and that was at the beginning. We weren't even ready to start yet. The room actually was filled. There was not an empty seat there. But being able to go into Sumter, into that community, and present this information, we got really good feedback. Even while we were there, it was a true community conversation. That was a meeting in a room of not just community members, but these were local nonprofit leaders. These are people who are doing work in the spaces that we're doing research in. So not only did we have a good community conversation, but we were able to identify resources within the room for other folks that were in the room. So it was really, really good. It was one of those things where when you go into a space, all of the things you could hope for as far as this type of event, a community conversation, happened. We had engagement. We had good questions. We had the care and concern towards what was happening in their community. We identified resources. And so it was really, really great to see. And they are looking forward to having us back. We will be back in Sumter County. More on that. If anyone on this call lives in Sumter or from Sumter, be looking out for us to make announcements about when we come back, because this was absolutely just a great time of discussion, and a lot of information was shared that was beneficial to those in the room, but also to us while we're doing our research. We take notes. We don't just sit there and take it in and be like, oh, okay, we heard you. Yep. All right, bye. We'll be back in a couple months. No, we take notes. And we already start working on the things that they want. If there were resources that they know that we have, that WREN has access to, we're able to share that with them, right? And so we are taking in this feedback. We are surely bringing back what we're learning from community to help us continue on in this work and in this research. So yeah, great turnout. Love being there in Sumter. The room, the energy was amazing, and everybody was so engaged. And I will say this, the folks in that room that are part of these organizations and community members truly, truly care about what is happening in Sumter County and the surrounding areas. So very good to see. There were healthcare professionals in there. It was a very good turnout and just a great dialogue.
Yeah.
Really
No,
great
that makes me so happy.
Yeah,
I did get the notes from that, and it was really fun for me to answer the questions and double check things and figure out where to go next. Which I do want to use that to note. This report will be kind of updated. We're hoping to get some help with that soon. But you know, if you do notice something that you're like, oh, I actually know a better stat for this, or that report you found is good, but it's just kind of old. We would love to see that, and then we can update our report accordingly as we do those rolling edits. So I just wanted to flag that we are trying to do that.
Yes.
And so I don't know why I put what's next, and I didn't know why. Oh, well, this is what's next.
This is what's next.
I mean, yeah, we're doing more
county visits all throughout the state.
Oh yeah, no, this is right. What am I?
It is right.
Yeah.
It's next.
Yeah, I was like, yeah, this makes sense. What we've done, where we're going.
That's right.
So yes, more county visits, more community listening. So stay posted, follow us on socials,
Yes.
See where we're going next. And then we've been beating that dead horse that this we want to listen to what is on the ground.
What is happening?
These numbers mean nothing if they're not accurate, like to what you're actually experiencing, right? So yeah, what are the actual challenges?
Yeah.
The gaps, the strengths. What solutions are you seeing that we can help uplift?
Right. And if there are organizations in your community who are doing work really well to help address these issues, let us know about them. Let us know about them, or invite them when we put this information out that we are coming to your county. Invite members of those organizations that are doing this work so they can be present as well and give us feedback and continuing that dialogue on this research in this report.
I have a question, it seems.
Oh, okay.
Do we know if Florence is on the list?
Florence is on the list.
Florence is on the list.
Florence is definitely on the list. We will likely be coming to Florence at the beginning of the year.
So stay posted.
So we have definitely some partners in the Florence area who we are in conversation with. They are excited about having us and hosting us. So yes, Florence County is definitely on the list.
Awesome.
I will be there.
And like we've said, this is going to inform and shape our agenda.
Absolutely.
So we are so excited to go out and talk to the people that are in these communities every day. And then I'm going to have to really shout out the webinars. So like I said, this is a first part of a two-part series. The next one is going to be Your Story Matters, Building Change Through Community Voices. And I'm going to have the wonderful Tori, who's our marketing manager.
Yeah.
Marketing. She has actually a very long name she wears so many hats.
She does.
So I'm really excited to have her. That will be December 17th at 1. So we're going to talk about storytelling, and then we're going to dive a little more on how these local voices are shaping our policy. So I'm really excited for that. Put it on your calendars.
Yes.
And when the registration drops, I hope to see you there.
Join us.
And okay, so I always put at the end of these, like how you can help, what we're offering. Whoa, we've been yapping. It's 1:57.
Oh, wow.
Well, all right, we're gonna.
Yapping through technical difficulties. Thank y'all so much.
This is usually when I say join trainings, webinars, or letter writing workshops, and then I say you can email Aisha.
Email me.
She's good at, and she
I
loves advocacy.
And I'm telling you, I love a letter writing. It's a workshop, but it's really a party guy. Let's be honest here. But yeah,
Yeah.
please reach out to me. She did. I can't see the chat if our email address is being in there, but our email address is on the website under about on the WREN website under about staff. Click on it. Boom.
Us.
Us.
And of course, take quick actions using the Action Center on our website. Speak out and share our social media posts. Using the Action Center, the legislators on Tuesday said how many, conversations they were having with their constituents. So it's important to tell them what you think. Share your story if you're comfortable. And bring a friend to these events. Two is stronger than one.
Yes.
And then, of course, stay ready to act when the General Assembly returns in January.
So there will no doubt be a call to action, guys. So we are excited about what's to come.
Yes.
And looking forward to having community along with us.
Yes.
We do this together.
Absolutely. Here's our resources. These are all located on our website. And here is the kickoff page. So we have
That's the question.
if you have to jet, that's totally fine. I'm just gonna, open this up for questions. Brianna was also having technical difficulties, so I'm gonna check and see if she has any questions via text.
We're always gonna figure it out. That's one thing about this WREN team. We will figure it out.
We're scrappy.
We are working through it.
And Brianna says no other questions, just a thank you. Well, thank you.
Well, thank you.
Yes. Thank you for being here. And I always have so much fun meeting with our guests.
Yes.
And talking on these webinars. And I'm just so glad that you guys are all here and attending. And I just want to thank Aisha for taking time out of her day to sit and hang out with me.
Thanks.
And I can't wait to see what this report yields.
Yes, I'm excited. Thank you, Katie. This is the funnest thing I have done today. I love this. I love this. Thank you, everyone, for being here. We are grateful.
Well, we are, and of course, thank you, Brianna, for being our Zoom bouncer.
Yes, Brianna.
So thankful for you. And everyone, I hope you have a great rest of your day. And I hope you have a great weekend.
Have an amazing weekend. Thanks, everyone.
Try to find how to close this.